This is a study from the Multisensory Experience Laboratory at Aalborg University, Copenhagen, investigating using immersive virtual reality in cue exposure therapy for individuals with alcohol use disorder. Alcohol use disorder is the world's third largest risk factor for disease and disability, and has a significant economic and human cost. Often, the onset of drinking is the result of an intense desire to consume alcohol, defined as alcohol craving. Exposure therapy has been successfully applied to relieve phobias and anxiety, but recently, it has also been applied in the context of treating individuals with alcohol use disorder. Here, feelings of alcohol craving are induced in patients for therapists to teach coping skills. Traditional methods of inducing craving include imagination and recalling techniques, seeing images or videos of alcohol cues, or being exposed to direct stimuli, such as a beer bottle. These techniques, however, do not properly represent high-risk situations experienced by individuals in reality. This can lead to transfer gaps and missing learning generalizations between therapy and real life. Therefore, methods should approach real-life situations as much as possible. As such, we see potential in using immersive virtual reality experiences to induce alcohol craving in patients. In this study, 2 experiments were conducted. The first experiment focused on discovering which specific elements of a 3D rendered virtual bar contributed most to making it feel real to participants. The second experiment compared 2 versions of the bar environment, a 360-degree video version and a 3D rendered version, to see if and how much they managed to induce feelings of alcohol craving in participants. This study concludes that being exposed to an immersive virtual reality experience of a virtual bar can induce feelings of alcohol craving. However, there were no measurable differences between the 360 and 3D rendered versions. The 3D rendered environment should be dynamic and interactive, with a primary focus on soundscape and virtual agents, but pros and cons were discovered for both, in terms of eliciting feelings of presence and plausibility. When utilizing immersive virtual reality to induce craving in cue exposure therapy, considerations of whether to rely on 360 video or 3D rendering should take into account the specific use case. Having the patient act as a passive observer in the virtual environment should favor 360 video due to the added photorealism. However, if interaction or locomotion is a strong preference, 3D rendering could be used, with a focus on creating high-fidelity soundscapes and virtual agents that react to user actions and promote how the real experience feels to the user.